Hey, my name is Jeremy, and today we're going to be learning how to do a wrist block. This has good utility for multiple lacerations on the hand or significant hand trauma to numb the entire hand so that you can close a large gaping wound on the hand that spans many digits, maybe even the palm and the backside of the hand, and also provides good analgesia for the patient. And especially if you're going to be transferring to a hand surgeon, rather than giving multiple rounds of morphine and opioids, you can block the hand with longer acting agents and make the experience more comfortable for the patient. We're going to learn how to utilize landmark technique as well as utilizing ultrasound to perform this block safely, and stay tuned.
Okay, so we're just going to look at some wrist anatomy here. So here we have a wrist, and if you pinch your thumb and pinky finger together, you'll see the palmaris longus tendon. About 10 to 20% of the population does not have this tendon. And just medial to that, you'll see the flexor carpi radialis. And then just lateral to that, if you see the pronunciation there on the lateral side, you'll see the flexor carpi ulnaris. And those are the three tendons that are crucial for this block. In between the palmaris longus and the flexor carpi radialis, you'll have the median nerve, which is where it sits in between there. And then medial to that, you'll have the radial artery and the radial nerve. And then on the other side of the hand, you're going to have some dorsal branches of those nerves on the other side that will need to be blocked as well. So it's important to know the nerve distribution patterns so you know if you even need to do an entire hand block or just the certain components. So if you look at the ulnar nerve, that's the easiest one to memorize. This takes care of the whole pinky and the palm in the same distribution on both sides of the hand through the middle of the ring finger on both sides. Median nerve is a little bit different. That pretty much takes care of the rest of the volar aspect of the hand and the middle first and thumb. And on the flip side, it just takes care of the distal portions of the middle and index finger. And then on the dorsal aspect of the hand and just slightly on that medial side of the base of the thumb, you have the radial nerve distribution. Just so depending on where your laceration is, you may need to do just a couple nerve blocks or do the entire wrist. All right, so now we're going to do ultrasound right at the volar aspect of the wrist there. And right in between these two structures here, you can see the median nerve. You can see how superficial that is to the skin surface. To the right of that, we've got the palmaris longus, and then to the left of that, we have the flexor carpi radialis tendon. And just see how superficial that is, so you don't want to go super deep with your needle, otherwise you're going to cause some nerve damage. And just flipping back, this is the area we were looking at between the palmaris longus and the flexor carpi radialis, and the median nerve is just right in the middle between those two. All right, now we're going to move to the radial side where we have the radial artery, and just medial to that we have the radial nerve. Notice this is also pretty superficial. That is how you locate the radial nerve via ultrasound, and you could do an in-plane block where you actually see the needle inject into the nerve area. We're actually going to show you a landmark technique in just a second. Okay, and now we're going to show the ulnar nerve. So fanning over on this side, we've got the prominent ulnar artery, and then just medial to that on this image, you see that shiny structure right here, and that is the ulnar nerve. All right, so now we're going to move on to our landmark technique. Once again, you can do in-plane blocks and see the area get anesthetized on the ultrasound screen, which does take some time, or you can just do this landmark technique, which is a little bit faster. Okay, so we showed you the median nerve block and then what the median nerve looks like on ultrasound. Remember, the median nerve is sitting inside the carpal tunnel, so you want to feel a little bit of a pop when you go in. If you don't, you want to go all the way down to the bone and then slowly withdraw and then aspirate into that space. Then moving on to the radial nerve, which we just looked at via ultrasound. We got the radial styloid over here on this side. We can actually start injecting here. We can inject right here, like next to the bone, create a big old wheel, and that way, now we can go more dorsally on this side, and it's not gonna hurt because we already anesthetize this area and get that dorsal cutaneous branch. And then we can shift our needle back this way and go over here, slowly aspirating. And if we stay about here, our artery is way over here. So if we stay here and inject a big enough wheel, that's gonna block that radial nerve as well. And now for the ulnar nerve, we need to come to the flexor carpi ulnaris. So we want to go under this tendon here. We can either have the patient flex, and we can go underneath that tendon, remember underneath, and we start injecting this way. The ulnar artery is over here, so you do want to aspirate first before injecting. Create a nice wheel. Every single block is going to be about 3 to 5 cc's. And then after you kind of create this block here, you can use that same injection site and kind of go up this way to get that final dorsal cutaneous branch over on this side. And then you can kind of do your testing and just make sure the block has been achieved. You want to wait a good 5 to 10 minutes before doing this. So 3 to 5 C's in about every single area will get your entire wrist blocked. This has great utility in certain circumstances in the emergency room, and it's good to have this tool in your back pocket.
Thanks once again for watching, and stay tuned for more.